The work that I would like to present is that integrated abdominal vessel wall imaging, a non-enhanced isotropic resolution MR approach to morphological evaluation for renal arterial wall and abdominal aortic wall. Renal artery stenosis is a common renal disease process. It is mainly caused by following three diseases: ARES, FMD, and autoimmune diseases such as Takayasu arteritis and polyarteritis nodosa. Nowadays, the gold standard of the renal artery stenosis is DSA. Besides Doppler ultrasound, CTA, MRA are also commonly used clinically. However, this angiographic technique lacked vessel wall information and could not differentiate the pathology of RAS, which could lead to misdiagnosis or failure in evaluating the plaque burden. In this way, we need renal arterial wall imaging to get this information. That is to say, via renal arterial wall imaging, we can evaluate etiology, the rather accurate plaque burden, and stability of the plaques. Besides, we can evaluate the effect of the physical, hormonal, and statin therapies. As far as we know, there's only one research about the renal arterial wall imaging before. The sequence they used for 2D vessel wall imaging is the ECG-gated BBDIR-TSE sequence, and here are its parameters. The limitations of this study are obvious, since the disease related to renal arteries are usually systematic, multiple diseases. The 2D imaging is definitely not suitable for its large-scale screening. Besides, renal arteries are very tortuous access vessels, which will introduce severe partial volume artifact when 2D imaging were used, especially for its 5 mm slide thickness. And the spatial resolution of the sequence is only 1.3 by 1.3, which is too low. This study proposed the first non-enhanced free-breathing isotropic resolution black blood 3D sequence iMSDE-SPGR for integrated imaging for renal arterial wall and abdominal aortic wall. The difficulties in renal arterial wall imaging are as follows. Firstly, renal arteries are narrow, for its diameter is only about 5 to 6 mm and its wall thickness is only about 1 mm. And it is deep in the abdominal, which will be influenced by the respiratory and gastrointestinal movements. And the SNR could be low for its deep imaging position and suppression of blood and fat. Besides, in consider of the tortousness and systematic multiple diseases mentioned above, we need fast, isotropic high-resolution imaging with blood and fat signal suppressed and motion trigger to elevate the motion artifact. The diagram and important parameters of the sequence are shown. We've achieved isotropic resolution of 0.8 mm. To eliminate respiratory motion artifact, respiratory motion trigger was used. Two rest slabs were used, one for suppression the fat signal from pre-abdomen, another were used to suppress the signal of the intestines in the left. Since gastrointestinal movement will also cause severe motion artifact, especially for the left renal artery, for intestines are closer to the left renal artery. Here are the results with and without the second rest slab. It is obvious that the vessel wall is clear with the rest slab and positioned on the intestines on the left. Then an iMSDE prepause was used for blood suppression. Subsequently, we chose SPGR for readout, and the fat suppression was achieved by water excitation PROSAT 11 scheme. 5 healthy subjects and 1 Takayasu arteritis patients were rescued for MRI experiments. All of the healthy subjects complete scan-rescan repeatability assessment. The 3D datasets were analyzed with custom-designed software by experienced radiologists. Lumen and outer wall contours of the bilateral renal arteries and the abdominal aorta were drawn manually with 5 mm interval along the vessels, and lumen area, wall area, and mean wall thickness were measured. The scan-rescan repeatability of the proposed iMSDE-SPGR sequence was evaluated using t-test and ICC. The sequence showed excellent scan-rescan repeatability for the renal arteries and the abdominal aorta in mirroring vessel wall morphology. And the proposed iMSDE-SPGR sequence was valuable to visualize the renal arterial wall and abdominal aortic wall for the healthy subjects. Here are the right renal artery and the result of the left renal artery for the healthy subjects, the abdominal aorta. And here is the result of one Takayasu arthritis patient. The stenosis on the right renal artery and abdominal aorta could be seen clearly on the CE-MRI image. And here are the results of the vessel wall imaging of abdominal aorta and right renal artery. The stenosis could be seen clearly. In summary, we've developed an isotropic high-resolution black blood sequence for renal arteries of both sides and abdominal aorta all at once. This is the first 3D vessel wall imaging sequence for bilateral renal arteries and abdominal aorta. Isotropic imaging for large coverage was achieved in this sequence. There are also some limitations. The sequence needs rather long scan time, around 12 minutes, and few subjects were enrolled in this study. At last, I would like to thank for all of my co-workers and appreciate particularly for all of the subjects involved in the study. Thanks for all of your attention.